So you're the first. Okay, I'll Frankie Yacht. 4 minutes question answer included. But let the Undersecretary offer consolidate the response first. Well, thank you for the deputations in this session. Allowed to offer consolidated response, and I'll defer to my FHB colleagues to respond to the report produced by a UK organization on conventional cigarettes. One deputation said that in human history, while smoking by combustion is over 1 century, in mid-19th century has become used by humans and become a commodity in early 20th century. And through scientific proof, we found that it is attributable to a lot of disease, for example, cardiovascular disease, cancer, and respiratory disorder. I will not repeat them here. So the government, besides your own, have been using different measures and taking a multi-pronged approach to try to minimize the tobacco consumption have been so deep-rooted to human civilization through legislation, enforcement, taxation, packaging control. I will not repeat them here as well. Or through education and public health policy. Last year, we have this 2025 of the eradication of communicable disease. One of the aspects will be reducing the smoking prevalence rate. So that's the first part of my answer. And for the new tobacco products, for example, HNB, that whether is less harmful, this is not exactly accurate. Even some studies, even those commissioned by the manufacturer themselves, that the aerosol from HNB, even though it was a lower concentration of them, there is no proof to show that there's no lasting impact on human health or have less of an impact to human health. So we not only care about the amount of substance released, or rather the any long-lasting impact to human health, just as we cared about the impact of traditional cigarettes to humans. Well, in an earlier session, I said the e-cigarettes have been in the market for over a decade. US is a classic example. Even if banning the sale of minors or below 21 is still a trend among the younger people, and it gets you uncontrollable. And the HNB just launched 45 years ago in different countries. Every year you can see a rise in consumption and the number of users. And precise, just they have, for example, the flavoring, the less impact to appearance, and while those appearance will still as less severe, provide a fixed sense of security, and they will overlook the long-term health impact. When it's really into the market, and due to the dominant narrative in the public, they reduce the public awareness of it, long-term harm, and will turn this product into another kind of a trend. It's quite similar to by analogy that the views on vaccines. So we promote a vaccine as a way to protect public health, and some will think that why do we have to take in check, or even the anti-vax movement. Even we stress in our papers and information, we have never confused HMB and e-cigarettes, whether on the amount of substance released or the literature have made it clear. There's no intention to confuse. However, I care about the long-term impact of human wealth. I now defer to the FHP. Dr. Feng Ying. So we heard from deputations and members. More frequently, they were mentioned about the Public Health UK's position on e-cigarettes. In the Public Health UK, in their statement, they feel that the e-cigarette will have the potential to help with quit smoking. Well, as similar to the a similar position with and consistent with the EU and US position. And most recently, the most frequently cited will be the New England Medical Journal, in which the medical study on the smoking cessation effect of e-cigarettes compared to nicotine patch and medication. In the studies, it was rather a double control sampling, and you can see that the e-cigarettes group is twice of nicotine patch with a cessation rate of 18%, with a nicotine substitute is about 9.9%. So it is the most frequently cited. However, when we analyze the actual findings, you see that 80% of those who tried by treating by e-cigarettes are still using e-cigarettes 1 year on. And our smoking cessation surface, well, first they have to cut off their craving for dependence on nicotine. And for the New England Medical Journal, the editorials have warned that we shouldn't accept that for the smoke conventional cigarette to indefinite use of e-cigarettes as a successful cessation. The smoke cessation rate is about 20% in Hong Kong. So where this study is considered as a successful cessation, we have grave reservations, and we don't see this study have showed that the e-cigarette can be used to help people quit smoking. Any further response supplement from the Bureau? No, thank you. Now open the floor to members, 4 minutes. First round, Mr. Frankie Yik. So whether we should ban or to regulate, we'll let Mr. Shukafai to discuss that with you. So my sector requests us to relate to the Bureau. Now that the e-cigarettes can be imported, the accessories and so forth, and they're engaged in this trade, and now the logistic industry are having a great difficulty. I hope that you can leave a hand and so not to shut down the business. They're asking you to allow the import and export. Of course, a different thing for you banning the sale, because a lot of the accessories on e-cigarettes are manufactured in Shenzhen, and then they will import into Hong Kong. They will be repacked by air cargo to other destinations in the world, and they will not enter Hong Kong market. I hope they can modify your bill and allow the transshipment so that the logistic industries can survive. I wonder if you're willing to consider it. Okay, the Bureau. FHP? So Mr. Yek mentioned there will be some just splitting up the shipment, and they will divide it into small packets and ship out. Because not a lot of them only require full containers, they have to split up the shipment. So they have quite not entering the Hong Kong market and then violate your policy, just allowing the business to continue in Hong Kong. It's quite similar to the Mr. Wang Qingquang's comments, because currently our bill also cover the accessories. on parts. But we're also worried. If you're worried about the full ban, if somebody will, let's say, would disassemble them to enter Hong Kong and allow the public to assemble themselves. So that's why we do have all the cover, the accessories. However, we can see if we could anything measures that will not affect our overall control. It's not as parts. It's just that the inhalation device, it contains none of the chemical substance. It's really just a device and equipment. If they enter the market legally, then the custom can make it arrest because they don't want to smuggling. They just want to carry on their business, and there's no impact to legislative intent. We'll look into the details. Thank you, Chair. Dr. Kiki Kwok. And first, thank you to all the organizations to coming to this deputations. I support the government's proposal for a total ban, and also on new tobacco products. Well, the big tobacco, while the business is declining, they try to put an efforts into the H&B and the e-cigarettes. And some would say that they claim that 40% of their income will be derived from new tobacco products. So I say the government is want to rectify the wrong and just nothing new. Well, in the government's position paper to let you go, they have to full ban on H&B and e-cigarettes. So I can see two things happening. I'm going to ask a question for Professor McKay and FHB. And now the big tobacco is going on a marketing offensive. They can see that they have this joint petition by news agents requesting for regulation. And second, and you can see that they have opened a lot of different battlefields. For example, whether asking for this and that exemption or import exemption or repackaging exemption. So they're creating a lot of loopholes and hoping to maintain the presence of e-cigarettes in Hong Kong. And now the government decided to ban the sale but not the consumption. So can you anticipate that whether through smuggling or underground channels, well, you can easily buy a lot of electronic gadgets online. And that is, well, let's say the website could be based overseas and shipped to Hong Kong. So how are you going to prepare for this? For example, online ordering of E&B, or maybe it can just enter Hong Kong. And third question, we feel that the government should make it clear enough that how do we gradually raising the threshold on import of conventional cigarettes, including the taxation and the cessation work. The government don't seem to put much effort into it. Can you state your position and what are your future objectives on tobacco control, on reducing the harms of conventional cigarettes, or setting clear objectives? Or what are the goals for 3 to 5 years in the horizon? Undersecretary? Okay, thanks for Dr. Kwok's question. Let me answer the last question first. So the other two, I'll let the team to supplement. On the regulation and control and on conventional cigarettes, we have a clear policy objective. Last year, we have issued the 2025 non-communicable disease strategy will continue to reduce the smoking prevalence rate from 10 to 7.5%. They will take a multi-pronged approach. For example, the packaging control, education, enforcement, and also through taxation. That will continue. And for the numbers are clear from 10 to 7.5% is the target for 2025. Deputy Secretary, maybe I didn't get your question too clear because Dr. Kwok claims of the tobacco marketing tactics to us. Our principles are clear. We are banning the sale, distribution, and promotion and marketing. We hope that this product, even though it's still used in Hong Kong, but before they become widespread, we can intercept their supply.
So people have said that they see people smoking everywhere. So if the e-cigarettes are not openly on sale, then the temptation will be lessened, and young people will have one less chance to be in contact with them. And there will also be absence of the aggressive advertising. As for the other channels for people to get the product, of course, we need to work on them. But as I explained, if I allow for the import of the product, we would expect the smuggling issue. Because like in the case of traditional cigarettes, there's the smuggling issue, whether you allow it to be sold or not. If you ban its sale, then people who want to smoke that would go for the smuggled products. So no matter what, we have to face this smuggling issue. So our preparation is such that law enforcement authorities like the Customs Excise Department will stem the influx of the products, and within the city, Department of Health will enforce the law. And just another mention about online channels. Well, we do receive an act on intelligence to curb the input of the products online through online channel. We also assess the risk, and we need to carry on with our work in curbing smuggling. Education is something we will not give up on as well. Even if the sale is banned, we will still need to let people know the harm of smoking e-cigarettes. So we want to take a multi-pronged approach so that we can have a higher chance of preventing the new products from causing or resulting in more smoking population. How about online shopping? I expect that more and more people would be selling or offering e-cigarettes online, as well as H&B products as well. Well, online shopping, we are monitoring the situation as well. There are products imported online. I remember the Customs Department said that some are sent into Hong Kong as skincare products. So we need to curb the flow from the channel, whatever channel they are. So we need to, of course, look out for the evidence as well. Imports and ordering the products online, it could be actually a violation of our ban on imports. So there could be penalties involved. As for manpower support, we will see what to do. Second round, Ray Chan. Thank you, Chairman. Chairman, I feel that the discussion this time on the total ban on alternative smoking products, of course, I don't support it. But even if we were to discuss, we need to have different areas for discussion. That is e-cigarettes, H&B products, and alternative smoking products, and future cigarettes. Now the government wants to apply a ban on all of them. Just then, deputations made relevant and feasible suggestions, that is to strictly regulate H&B products. Some even said before that you could raise the age limit, and also we need to give up the timetable for total ban on cigarettes. But when it comes to issuing a timetable, the government wouldn't do that. It would not be prepared to launch a timetable because this timetable is 2025, 7.5%. And WHO is okay with a 5% limit. So there won't be a timetable for a total ban on cigarettes. The latest amendment is the ban on selling and not consumption, if my understanding is correct. Ban on selling, and not on consumption. What do you mean? That is, you impose a ban on people selling them, but you're not banning buying the e-cigarettes. As long as you have a way to buy the cigarettes, of course, those who sell it to you, they will be breaking the law because they'll be distributing the cigarettes. But the act of buying is not banned, right? That's my understanding. So as long as you get the cigarettes for your own use, even if you receive a postal package, well, with the cigarettes, if you're using the cigarettes on your own, then you're fine. And members also talk about transshipment of e-cigarettes. Well, I'm sure Liberal Party opposes the amendment, but if you want to leave a way out for the sellers, then you should not actually support the entire amendment bill altogether. Say selling of firearms. If you allow for transshipment of firearms or processing of firearms, once you allow that, then there will be a chance of the firearms being disassembled and then resold or repackaged. I'm just saying that if you want to have a total ban and yet open the door for transshipment, I think that is contrary to the spirit of the law of the amendment. And the government, could you look up the following information for me? Any examples of products you have on which there are a ban on import and distribution, and yet the ban does not apply to personal consumption of the product? So, of course, the latest amendment bill is such that the government argues that if nobody sells it and you are using the stock on your own, for yourself, then that's it. But that could be for the person buying, if it's not illegal for someone to buy the products. Is that what you think? Under Secretary, please. Or DS? Thank you, Chairman. Let me answer the last question first. We mentioned several times that the non-smoke tobacco products, which would date back to the 1980s, are like the case of the ASPs and the under Smoking and Public Health Ordinance Section 321, the ban of sale of cigarettes to minors, so the responsibility lies with the sellers. So people who buy it for their own consumption is not breaking the law, is it? If it involves like shopping online, that could be a breach of the import law. Well, if you order it because you are bringing that product into Hong Kong by ordering online, then you could end up breaching the ban. So simply put, the proposal is such that there's no penalty for the person buying the cigarettes. As for the Dutiful Commodities Ordinance, it has its own coverage, but our purpose is to stem the flow at source. So we need to follow the non-smoke tobacco products ban. We're not trying to penalize smokers. Ultimately, we hope people can quit the habit. So the penalty applies to people selling. And I hope that by reducing or by curbing the source, then people will not use the e-cigarette products. And Ray Chen mentioned a few times about the timetable, our timetable for a total ban on cigarettes. We did give you a written reply in response to Ray Chan's question raised at the Bills Committee meeting. That is whether we can change the long title. Well, he is asking about the long title of the bill, and based on the rules and procedures, the long title unless is unclear or doesn't fit the content of the bill, otherwise it would not be changed. So I'm saying that if we just change the long title, it doesn't work because it would not fit the content of the bill. So I need to change the content first before changing the long title. Yes, that's another matter. In the bill, we're talking about ASPs. So it's not that if you delete alternative in the long title that will work. That doesn't work. As health-related department, we of course want to see a total ban on smoking, but it's all about priorities and dealing with new products first. Thank you. Me, the third round. Having heard in the second session, deputations mentioned that whether you have a total ban or regulation, you cannot deal with the contraband cigarettes, particularly for particularly for the not burn cigarettes. And they said that you cannot stop people from smoking. And earlier media also suggested that, well, if people, parents don't want to be exposed or the children to be exposed to secondhand smoke, and so smokers should not, move around as they smoke, and some people could be allergic to smoke. So the government, in response to all these claims, have you made any considerations on how are you going to cope with that? Thank you, Chairman. Recently, we know that in South Korea, a relevant law was passed. I don't know whether it's been implemented, but people did ask us our position. But basically, once we have a bill passed, we should be able to enforce it. If you say that we should not allow people to smoke while walking, is that enforceable? If you want to enforce it, then maybe the concept is such that everywhere there should be, all places, public areas should be non-smoking. So there'll be very few public places available for people to smoke in. Our past experience show that when we want to expand the non-smoking area, we had to go for various rounds of discussion if we want to apply the same approach, which is different from now, because now we have allocated restricted smoking areas. But if you want to go for the other way, that is to ban smoking in basically all public areas, then that would mean that, we are expanding largely the non-smoking areas. So if that's feasible and whether it's acceptable, we need to go for further discussions. We can't make a decision now and tell you whether we will go down that path. But in the long run, we hope to gradually, in a gradual manner, expand our non-smoking areas. Okay, I'd like to mention as well, in the last meeting and also today, quite a number of deputations mentioned that for tobacco manufacturers, to produce the HMB products, what is their real motive? Are they doing it for the health of existing smokers or to reduce the unpopularity of traditional cigarettes, or because they have less, they're odorless, the heat not burn products? But theoretically, the tobacco traders will not, produce or manufacture new tobacco products at a loss. So smokers will either continue with conventional cigarettes or switch to e-cigarettes. So they're all part of tobacco traders' business. So they have nothing to lose. They're not expecting to suffer any losses by introducing new products. They're just trying to explore new markets. I don't know whether it's totally accurate, the analogy made that it's like property developers are selling 9 flats. On the surface, it seems like, they are giving you smaller flats at a lower cost and to reduce your financial burden by offering 9 flats. But their real motive is just to support the property prices per foot on the per foot basis. So what is the real motive for the reason for the appearance of HMB products? We need to look further into that. I think my time is up. Now we have the fourth round. Shu Kao-fai. Sorry, please switch on my mic. Okay, yes. Well, I've heard from deputations from the medical sector. I welcome their presence and views. People have said that because of credits. Medical students came here for the sake of credits. But I do hope that the medical students here mainly to find out more and also to express their views. In this session, I hope that students, please try to look up for the evidence. Same for the reporters. In our discussion, Well, we've been having a long discussion on this issue, and I've been saying that the government, you're trying to mix e-cigarettes and H&B products, and there's several myths or fallacies. Deputations, even in this round, many of them were talking about addressing the issue of e-cigarettes that are available to children as young as 10. But no, there are very few mention of H&B products. Even for e-cigarettes, why is it that 10-year-olds can buy them, and yet the government did not regulate them throughout the years? Why would e-cigarettes be available to people under the age of 18? Why would the government allow that to happen? The government now have bundled e-cigarettes with H&B products. Well, now before you have Koch spending more than $100 million a year to curb smoking. What you said, however, you need to reflect the truth and be comprehensive. You cannot just review partial truths. You asked Baptist University to produce a report. I mentioned that at a meeting. You are using Koch study done by Baptist University to show that e-cigarettes contain chemical substances and so forth. Last time I asked Sophia Chen, why is it that people can smoke e-cigarettes for 12 minutes, but usually for not traditional cigarettes, people cannot puff for 12 minutes continuously. You said you've made reference to US FDA and the ISO. I asked the committee to ask Sophia Chen directly, ask her to show us the report. I tried to get her to give me the results of the study done by the two organizations, but I didn't get any answer. Now you are trying to promote sell to us your paper, FHCR1 stroke 3231 stroke 19. In its appendix B, 26, paragraph 26, you mentioned that that in UK committee and another cancer risk committee in the UK, they pointed out that H&B products data come from the tobacco industry, from there are limited information from independent sources. The review also showed that H&B products create smoke that contains harmful substances that poses risks to users' health because of the inadequacies in existing information, and since there are hidden health risks in these harmful substances, and it's not known what is the right dose. Therefore, you cannot quantify the relative risk of H&B products. This is one point you use to try to convince us about the need for change. But I've also received letters which say that, well, citing the same report, the UK Food Consumption Products Committee in November 2017 concluded in the report that compared to conventional or traditional cigarettes, H&B products emit less chemical substances. Therefore, for people who have switched to H&B products, the risk posed to their health could be less, even though it's not zero risk. So is it from the same report? How come there are various ways of interpreting it? So I hope that the media could look up more information, and medical students, I hope that you can also look at the papers and look up, for me, the real information. Why are there different interpretations of the same report? Can I continue, Chairman? Well, Tommy Jung is in the queue. Okay, you can finish first. Well, you have to wait for the next round. Sorry. You have to wait for the next round. Okay, it's okay. I have time. So, okay, you may continue, yes. So the same passage, paragraph 26, also points out that Philip Morris International, well, didn't give me any vote. The vote would have gone to Wong Ting Kwong or the chamber. But on December 5th, 2016, ICOS, they submitted to the Philip Morris claimed that switching completely from cigarettes to IQOS can reduce the risk of tobacco-related diseases, and yet the TPS AEC rejected Philip Morris International's claim unanimously, and the committee also rejected the claim that switching completely to IQOS presents less risk of harm than continuing to smoke cigarettes. So, Philip Morris, in the previous round or session, they pointed out 23 patents showing that if you consume IQOS, the result will be worse than smoking cigarettes. And yet the committee, the FDA's Tobacco Product Scientific Advisory Committee, objected their claims. But the latest FDA already approved one of the HNB products submitted to it. So you may want to double check that. What I want to say most is that in this same report, PMI also mentioned that is Philip Morris International. The same committee voted 8-1 approve IQOS application, which is to claim that scientific tests show that if you switch from conventional cigarettes to IQOS, it can reduce human exposure to harmful substances.
Why
don't you also submit that report to us? Why do you only show one side of the picture? That is unfair. This is what I said at the last session, Chairman. You mentioned 30 countries that ban the use of these products, but you did not mention the other 60 countries. It's okay for you to care about the health of Hong Kong people. I am in the same category, but then there is actually a choice. You show this paper to the bureau chief and then the CE, but who formulated this paper in the first place? You have not shown the entire picture. And medical students, you can think about what I'm going to say, whether it is correct or not. If you do not gamble, if you do not engage in soccer betting, if you don't smoke, if you don't drink, that will be the best. But then this does not happen in Hong Kong. If that is not a total ban on tobacco, then if these products are shown to be less harmful than conventional tobacco, then why do you want to crack down on them? You have been shifting viewpoints, saying that these cannot help you quit smoking. Well, no one is saying that these are cessation products. They are just a choice. As I said at the last session, they have less of the 4 substances compared to conventional tobacco. Why don't you allow people a choice? You are submitting prejudiced data. This is very unfair. Okay, I'll let them speak. 2 minutes. Well, very briefly, talking about para 26, as mentioned by Mr. Shiu, I believe he is referring to just one part of the paper, but then we have read the entire paper that Mr. Shiu mentioned. And you can see that we were not being selective. Rather, we actually gave a comprehensive picture. As for the FDA, we have mentioned the Tobacco Products Scientific Advisory Committee. And their view is science-based. And maybe FDA has considered other matters. Mr. Shiu, if I have heard you correctly, I think you are talking about exposure. We have been trying to explain one point which is not easily incomprehensible, and that is exposure does not always equal the harm done. There may be fewer toxic substances, but it doesn't mean that there will be less harm for the human body. Chairman, the Bureau and other groups are just saying one thing. You are saying that no matter how small the amount, it is still harmful to health. I won't argue with that. Look at vehicle exhaust. It is harmful to health. And even when you breathe, you may be doing harm to other people. I cannot argue with you about that. But what I'm arguing is that compared to conventional tobacco, it is less harmful. If you cannot prove me wrong, and that is, it is less harmful than conventional tobacco, then I can't see why you are prohibiting H&B products and not conventional tobacco. You are still not explaining your logic. You have stuck to one point. You are saying, well, even if it is less harmful, it is still bad for health, right? I understand that. It's a well-known fact. It is all right for you to shake your head. Go ahead. Well, I won't close your microphone. Thank you. We are saying that the toxicants may be fewer, but it doesn't mean the harm is less. I understand. Exactly, this is what I'm saying. Sorry, our time is up. Let us wait for the next round. This is the end of this session. Thank you very much, deputations and individuals. Thank you for coming. 5 minutes later, we'll start the next session.